Orthopedic conditions means injuries and diseases that affect musculoskeletal system. Muscles, bones, nerves, joints, ligaments, tendons, and connective tissue constitute musculoskeletal system. Then the important orthopedic injury, the fracture. Regarding fracture, it is a multifaceted pathology. Judicious management requires rational, holistic, and a skillful approach. What is the aim of management of the fracture? Aim of management of the fracture is to restore normal or maximum biomechanical movement or near to normal structural integrity and physiology of the fractured part at the earliest. This is the aim. Without complications or with minimal complication, we can manage fracture. This is also the another aim. According to Ayurveda describes fundamental principles and technical management of the fractures. This contains first aid management, then reduction, then immobilization, and the various therapies we are using to bring the normalcy. There are a array of oral medications also which promote immediate healing or promotes early healing. We can incorporate Panchakarma methods also for regaining maximum normalcy. Dietary regimens are also there to reduce the edema, to promote fracture healing, and to regain maximum normalcy. With these golden standards or golden rules, and with this immense knowledge, we can manage many injuries successfully with minimal rate of complications. Some of the injuries require surgical management. Even though Ayurveda can play a crucial role as an adjuvant therapy supporting early healing of fractures and regaining mobility. We doctors are always getting of many ortho cases in OP. I tried to classify these cases coming in OP into three. These are broadly classified into three. One, fracture. What is fracture management? As far as fracture management is considered, we have to diagnose it. Then we have to determine it. Is it manageable or not manageable? If manageable by us, we have to formulate a treatment plan before managing the fracture. Then B. This includes cases other than OP, other than fracture coming into our OP section. These are contusions, ligament injuries, sprains, repeated strain injuries, sports injuries, and a large number of OA cases. Then coming to C, these are the cases which have undergone post-operation or surgical management, and we have to give post-operative management for regaining mobility, stability, and proper function of the joint after immobilization and POP administration. We have to go to the merits of Ayurveda in ortho cases. Coming to the merits, there are detailed description in classic tests regarding these injuries, especially a chapter of Marma Vijnana is there, and Shastra taught us about the different bandaging techniques and Stavano bias, and description about the complications are also included, and the classical medicines for early healing of this bhagna. Various kriyakramas, panchakarma kriyakramas, anushastra kriyakramas are also mentioned in this textbook. Then ahara viharas for early healing and regaining early mobility and overall health. The orthopedic principles and methods described in Ayurveda by our ancient acharyas in different texts are also relevant with a very sound base that they hold good even in present time. Then we come to initial management. Ancient test, Yoga Ratnagara describes about it. Yoga Ratnagara advised sprinkle cold water over the injured area. By sprinkling cold water, Shadoshma will be diminished or inflammatory condition will be diminished. After that, apply a layer of mud immediately after injury. There is a rule that before applying a layer of mud, we should be sure that there is a fracture or a skeletal injury and it can be reduced by a closed fracture. Then we can apply this mud. Cold water on the injury sites constricts the blood vessels of that area and this results into the less hemorrhage, less swelling, less blood loss, and reduces irritation of local pain receptors. This is the version of Yoga Ratnagara, and in Ashtanga Hridaya and Susruta, they recommend Dhara with cold water. Sprinkling will lessen the swelling. Dhara also will reduce this Shatoshma and it will also ensure the lessening of the inflammatory condition. Then in case of this mud, this acts as a temporary well-controlled split. Remember that our POP is also a refined form of mud. Mud is a local cooling agent, but we are often using POP, and in the usage of POP, some patients cause irritation and itching also. In our Kerala traditional practice, there are a lot of preparations which can be used instead of mud. One or two, or 3 or 4, 5 I collected from various textbooks. I will describe about it for your usage. 1. The paste of Nalpamara powder, powder of Shodhita Shalu, that is rice flour, and Manjishtra powder and Yashti Madhu powder with butter can be used as paste instead of mud. This will give good relief, and we can keep this medicine powdered and use according to the need. The second one is egg white. Egg white is using as a medium, and Chenninayaka or the internal pulp of aloe vera tree. This is tried. This is called Chenninayaka in Malayalam or Sanninayaka. Plus Meera. Meera is the Hira bowl and powder of Devadaru with Yashti Madhu. Again, Yashti Madhu is coming. In Yashti Madhu has an important role in fracture healing, and these 5 of the ingredients can be used with egg white and can be used instead of mud for it can be used at the time of the splending or immobilization. Then the third combination is Sanyanayaka again with kashkash, Hira bowl, and Udadu powder. Udadu powder is, we are always using Udadu. Udadu powder or Udadu paste. For making idli, we are also using Udadu powder. This can be applied with the egg white. And the fourth one is Ulpala. In Malayalam, Ulpala is a tuberous root. It is called Chengadi Neerkadang. And Jagari in Malayalam, it is called Chakara. And again Udadu powder These can be mixed and paste and can be used instead of mud while we are splitting the and bandaging plasters. Then another combination is also available. This is pasted bella leaf, jaggery, udadu paste, and laksha. We all know laksha is a Pakna Sandanagara Devya, and laksha can be powdered and can intake with milk for an early joint of early Pakna, early cure of Pakna. Laksha can be taken. Laksha can be taken with the milk. There are some golden guidelines in classics. Yesterday, I remember that Dr. Jiku Elias Benny taught you about the rule 2 and other rules regarding fracture management. And in Ayurveda also, there are golden rules, guidelines regarding this fracture management. This is the rule. Anjane pidane cheva samshebe bendane stada sandin sharire sarvastu chalannibi ajalannibi erestu sabanobaya. This is regarding reduction of fracture. Anjana means traction. This anjana can be, we are using this anjana at different methods of anjana in different sides of fractures and dislocation. We are using a peculiar type of angina in Colles fracture, and we are using another type of circulatory angina in temporomandibular dislocation, and another type in foot dislocations, etc. These angina, different modalities of angina or traction methods are accepted by the universe, which are mentioned by Acharya Susruta. And this is Pidana. Pidana is the compression. Pidana is the compression. Then, when there is a Colles fracture, we are giving angina by holding the fingertips by a man and holding upper arm by a man and unilateral in supine position, and a longitudinal traction is giving and reducing this angulated portion by pedana or depression. This is the reduction method of Colles fracture. In temporomandibular joint dislocation, we ask the patient to sit in a chair and ask the patient to open the mouth as he can. Then we are putting our two thumbs inside the mouth as much as possible. Then we are holding our index finger at the angulatory part at the lower jaw, and we are pushing this joint 3 or 4 times in a circulatory manner, and requesting the patient to open the mouth and try chewing. This is the type of pedana or angina we are giving at the site of temporomandibular joint. I described 2 types of angina which we are using in fracture management and pedana. Then samshepana is reduction or compression. In every case of fracture management, we are using the samshepana kriya by holding tightly or compressing the site of fracture for proper alignment. Then the another technique is unnamana or pulling upwards. If a part is depressed from the baseline of bone, we have to lift it properly and elevate it properly. This method is called the unnamana. And vinamana means pressing downwards. In an angulated one or elevated one from the baseline, we have to depress it. These are actually with these 4 techniques, we can manage any of the fractures happening in our body. Then avanamidu munnakil unnadamcha avapediyil anje adishiptam adhogadamcha uparivakte. This is the another method of rule of reduction. Avanamidam is also the depressed one. Avanamidam unnahil, lifted. And if there is elevated portion, or if the fractured portion is sitting above the level of the baseline of the asthi, we have to in Unnata state, we have to depress this avapidil. If it is adishipta means too shallow, anche, pull it up. And if it is adogada, lift it outside to the baseline, that is uparivartanam. These are the rule of reduction to apply. Rule of reduction is to apply the opposite forces to that forces responsible for injury to reverse the mechanism of the injury. This is well stated and everybody can understand the Shastra. Traction and counter-traction methods have been advised for reduction and immobilization of fracture of pelvis. Fracture of pelvis requires special attention. In that cases, counter-traction and traction is needed for proper alignment. Then what are the factors influencing fracture healing? As per Susruta Sampada, age of the patient. Early age, it is easy. The physical status of the patient and the nutritional status of the patient. Because there have no, in calcium deficiency, in vitamin D deficiency, it is risky to heal the fracture earlier. And the type of wound involved and the techniques of management, seasonal variations. For doing Bentha, the seasonal variations are important. Grishma Ritu, it is too hot. Shishira Ritu, it is cold. Ritu, in Ritu, there are fluctuations of season. In the Pragati, the psychosomatic constitution and the anatomical factors. Judicious knowledge of these factors improve outcome of injuries. What is the prognosis of fracture management? Prognosis are of three different types: Sukha-sathya, Kashta-sathya, and Asathya. Which fractures are Sukha-sathya? Patients with fracture in Balyakala or childhood, it is easy to manage. And Alpa-dosha yukta fractures, hairline fractures, and fractures which happen in Shishira Ritu. And with a good nutritional status, they are easy to manage and we get a speedy recovery. What are the Kashta-sathya or the Kashta-sathya fractures? Or we can do with extreme difficulty. Churnida Patna, comminuted fracture, which are often caused in road traffic accidents, etc. And incomplete fractures like Chinna Patna, and complete fractures, Adipadita Patna, and impacted fractures, Majjanikata Patna, and intra-articular fractures. These type of fractures are Kashta-sathya and can do with extreme difficulty. More attention has to be paid to this type of fractures while we are treating this type of fractures. Part of the Asathya fractures which do not try, we have to exclude or refer to another skillful person or Dhanvantariyas. Complete fracture and dislocation of pelvic bone with displacement is Kashta-sathya. Churnida fractures or communicated fractures of special bone, frontal bone and iliac bone, it is also Asathya. Cranial bone dislocations are also Asathya. As far as the cranium is concerned, skull is a hard object and very high blow or RTA in which these dislocations, there may be the chance of heavy bleeding, and Panchendriyas are situated in cranium or our head. These all factors made this Asathya. Then the fracture of the sternum, fracture of vertebral column, fracture of cranium, and fracture of temporal bone, all these fractures are coming under asatya. Then, Paknam or fracture can be divided into two, one Sandhi-mukta and Kandapa. This everybody knows, only for brushing. Sandhi-mukta or joint injuries are of 6 varieties. Ulplishta. In Ulplishta, there is fracture and dislocation. In Vislishta, there is incomplete dislocation or subluxation. In Vivarita, it is lateral displacement of the dislocation. In Avakshipta, it is a downward displacement of the dislocation. In Atikshipta, the overriding of bones with the dislocation is happening. And in Tiryakshipta, oblique displacement with the dislocation. These are the 6 varieties of joint injuries which are handled with the utmost care. In between these 6 varieties, there are two numbers which do not to be manipulated. These are Ulplishta or fracture with a dislocation. In yesterday class, Dr. Jiko Elias was describing in the shoulder joint dislocation, and he has very neatly told about the degree of elevation and the muscle supporting the flexion, degree of flexion and muscle supporting the flexion. And he advised us to do not manipulate if there is supraspinatus tendon injury like it. In Ulplishta, this type of this injury will be, there is chance of this type of injury. And if we manage this type of joint dislocation without knowing the actual status, it will increase the dislocation, and it is very difficult to manage that. In Vislishta, there is incomplete dislocation of subluxation is there. Here also, without doing clinical examination, proper clinical examination, and without knowing the proper status of apnea, if we tried manipulation, it will go worse and it will be difficult to manage. This is kind of apnea. These are all 12 types. This is also for brushing up your knowledge. Karkadaga, Ashwakarna, Churnida, Ichida, Astichalida, Kandapakna, Majanikada, Adipadida, Vakra, Chinna, Padida, and Spudida. These are the 12 types of bone injuries. Among these, the 4 of the above is difficult to manage. This is the Churnida. As everybody know, in this multiple broken fragments, there will be multiple broken fragment. The alignment of this fracture will be difficult. So it is said like that. In Chinnapakna, a bone is broken from one side. This is also difficult to manage. And in Adipadida, the entire bone is broken into pieces. In this case also, close reduction is difficult. And in this case, so very careful open reduction is needed. In Majjanigada, bone is getting into marrow. In this case also, utmost care should be taken, and it also needs open reduction. In Ayurveda, diagnosis of the skeletal injuries are based on clinical features, and clinical examination is so important. And treatment is mentioned only for closed methods. No treatment line is mentioned for open method or internal fixation of any kind. Nowadays, in fracture like a scaphoid fracture, we need if it is unstable, deal with careful management. It also needs open management. In closed management also, external screw is needed. For this type of management, these type of fractures will be managed with the utmost care to avoid further complication. Nowadays, there are various diagnostic tools are there. Please take an X-ray before and after reduction. This will be, or if necessary, you please take USG, MRI, or CT for an accurate diagnosis. An accurate diagnosis will always help you to lead an accurate management. Acharya Susruta has described many methods. These are extremely useful. Logical and practical approach of determining various types of fractures along with symptoms, prognosis, healing time, medicines for healing, and healing time of fractures according to different age groups has mentioned in Susruta Samhita. What are the general features of Kandapatna? Let us examine. This is market swelling. This will only reduce after the reduction. Otherwise, we are bandaging without reduction. This swelling will not go. There will be tenderness. There will be soyetu bahulyam. There will be crepitus. Crepitus is also a leading sign. It can by knowing crepitus and by hearing crepitus, we can confirm the diagnosis. There are different type of pain: osha, ruja, daha, toda, etc. These type of pains depends on the nature of trauma and the bone fracture and displacement of fragments. Polys fracture and scaphoid fracture are very painful fractures, and this pain is also depend upon the nature of the soft tissue injured. Sarva avastasu sharmam nalapati. This is the another point in fracture. It gives pain and discomfort to the patient till immobilizing. For the treatment purpose of Phagna, it has been divided into two types. One, Avrana Phagna, closed injuries, and Savrana Phagna, open injuries. In Avrana Phagna, or closed injuries, and Savrana Phagna, same type of principles of management has been described. In open injuries, priorities will be towards the management of vrana. After healing the vrana, we can reduce this underlying fracture. If there is any protrusion of bone from the vrana, Acharya advised it to cut. It should be to chedana. After management of vrana, bone or joint injury should be tackled on the basis of common treatment principles. Then regarding medicine, oral medication or systemic medication or local medication for application of the for fracture management, and medication through parental routes are given in our textbooks. Do's and do nots are also given, dietary instructions are given, and lifestyle modifications are also given. Then what is the what is reduction? First principle of fracture treatment and is done if required. If required means if it needs an open reduction, do not attempt for reduction. This is a process of realignment or correction of fracture fragments or dislocated or subluxed joint to their respective anatomical position. This is the definition given. These are of two types again, closed by physical management and open by surgical management. And nowadays, reduction is performed manually by gravitation traction or skin traction, skeletal traction, or the screwing method, Steinman pin or Denham pin, which I have said in a scaphoid, unstable scaphoid fracture. Indications. In open fractures associated with a neuromuscular compromise, open fracture reduction is needed. Even though in cases like Parkinsonism, open fracture reduction management Then there is also always shaking or companies them. Then there is also chances for complication. All displaced fracture. In displaced fractures, we need open reduction. In ipsilateral fractures or in extremities, these also needed open reduction. In case of irreducible fractures, fractures with a severe injury, poor prognosis, and incidence of associated injuries, and pathological fractures, these all needs open reduction. Then what about closed reduction? In case of non-displaced, favorable fractures, and in case of closely comminuted fractures and fractures exposed by significant loss of overlying tissues, closed reduction can be applied. Bandhana or immobilization. This is the next method. After injury correction or reduction, this immobilization is needed. Immobilization gives stabilization. Immobilization is stabilization till the fracture and unites. For the immobilization, there are two methods: Kusha and Bandhana, splindage and external immobilization. That is this. Then there is Kapadashayana, an excellent method for fracture reduction. Very much skill is needed to do this Kapadashayana. Nowadays, it is not practiced by many physicians. This is otherwise called a fracture bed. Immobilization of fractures involving back, pelvis, chest, clavicle, and lower limbs need Kapadashayana fracture. Regarding bendhas, there are 15 types of bendhas. Koshadama, Sustiga, Nivelida, Muktoli, Mandala, Stagiga, Emaga, Kadwa, China, Vibandha Vidana, Gopana, Panjangi, and Ulsangi, and their sides are also described by Acharya. Then about this fracture bed Kapadashayana, it prevents all type of movements and complete immobilization to the injured part. Patient is laid down on the wooden board and the fractured limb is immobilized. For this, 5 pegs are needed or stakes in 5 different places. 2 pegs are fixed on both sides of the joint, distal to funga in skeletal injury. 2 pegs are fixed on both sides of the joint proximal to funga. Distal pegs are needed at distal end and proximal end also, and 1 peg is fixed on the side of the sole of the injured. This is the method of fracture bed. In fractures of tibia and fibula, 2 pegs are fixed near the knee joint and 2 pegs are fixed near the ankle joint, the distal and proximal joint, and the last peg is fixed near the sole. Fractures of the femur and tibia, 7 pegs are often used. About physiotherapy, this is also mentioned out in our Ayurveda text. Sukha Cheshta Prasara is the word. It is to bring vitals back to normal function, bring vitals normal and functions normal of the affected part at the earliest, and for gaining strength of bone and soft tissues. Sushruta Samhita, under management of fractures of bone and palm, especially metacarpals, weight taking is described for gradually increasing weight bearing. Birkpenda is mentioned. It is ball of clay. It is helpful to absorbing the Soedu itself, and then Levana. First Birkpenda, then Levana. It is also helpful to absorb the Soedu itself, and for the easy movement of this fingers also, and finally to lift the Pashana after attaining Pella in this form to regain strength. This is the 4 stages. Then we are coming to the phase 2, specific management of different type of fractures. With the wound or a compound fracture. In case of a wound or compound fracture, local application is needed. I have earlier described the base, which can be used. In specific management, Acharya opines that paste of Necrodhadikana Drivyas or Nalpamani with Madhu and Ghee. Madhu, Ghee and Ghee are Ranasandhanagara Drivyas. And the rest of the management is Anjalam, Pedalam, Samshevam, Vendhalam, etc. can be used in the specific management for different type of partners. In case of phalangeal fracture or dislocation, the technique is to reduce and bandage and sprinkle with ghee. In this fracture, a reduction is done by the pulling of the affected finger, the fracture, and then the fractured phalanges become straight. In case of proximal phalanx, a rolled bandage should be placed under the palm and then the affected finger and flexed over it and kept with a crepe bandage. This ancient methods resembles with modern management also, in which affected part is supported by bandaging and it along with the splint or neighboring finger. In Thalapatna or fracture of sole or metacarpal bones, first we have to massage gently with ghee, then splinted up and then manage to immobilize. Kusha or splint placed underneath the bandage. Patient is prohibited from doing any kind of activity with foot. Fractures of the base of metatarsal are usually managed with simple immobilization bandage. Distal fractures of the metacarpal shaft, particularly the first metatarsal, it is treated directly by internal fixation, because there is a reason that we have to ensure proper alignment of this weight bearing portion of these bones. Due to the weight bearing, full weight of a man is coming to this point. So, in this case, internal fixation is needed and it is better to refer. Dislocation of Lisfranc joint, the middle of the palm, it also can be associated with the multiple fractures and it can be any number of metatarsal. It is also not easy to treat and it can be referred to the experts. Then considering fracture of tibia, fibula and femur. First the massage should be done with the ghee, then traction is applied along the direction of the body. Here the traction is applied along the direction and it should be reduced, and this is a method of reduction and it should be sprinted with the barks and manners. In case of, as I said earlier, Kapadasana is required for absolute immobilization. In case of fractured arm, it should in this fractured arm also it should be kept in a supine position and traction along the direction of the bone and fractured fragment should be reduced with the help of the thumbs. Fracture of metacarpal bones of the palm. The two palms should be made even and opposed and bandaged together for support. In case of reduction, it is for attaining anatomical normalcy. The lengthwise reduction is needed. Displace the fracture should be reduced. These points should be considered. In case of a metacarpal bone fracture, these both hands should be split and should be applied to each palm for the support. In this case only, affected part should be sprinkled with the thaila because this place contains less mamsa. Please listen. In all other cases, ghee or sneha, which consistency is higher than thaila, is used. In day-to-day practice, we are also all using murivanna for application of body Kharapaga. Acharya always mentioned Kharapaga. But this Mrivanna is prepared in Mridupaga. Because in fracture cases, there is always Soyathu. And the pH of and absorption of this part differs from the normal part. So, Mejuku Paga Taila or ghee is applied in fracture management. In the case of cervical spine, causing lateral flexion of shortening of the neck. In case also, upward direction traction is described here for reduction. But I had a case 10 years ago. There was a man named X. He was traveling in his bicycle after taking some amount of alcohol. Achanak gir gaye, or he felt he met with an accident and he fell into a drainage. Unnoticed, he remained there for 3 hours. Fracture for the spine is occurred and paralyzed. He got paralyzed under the neck region. These type of cases will be occurring. So be cautious that there is no complication. If there is no complication and only the lateral flexion or shortening of the neck, then apply upward direction traction. This is why yesterday he said that perfect clinical examination and radiological examination and diagnosis depend upon radiology is needed before treatment. Around neck, an appropriate splint and bandage is used. Patient is advised to take rest in supine position for next 7 days. In such complicated cases, nowadays, Philadelphia collar is used by allopathic surgeons. Then in the case of fracture of rib or Parshik Astipatna, it is anointed with ghee. Listen, look, there is ghee is applied instead of thaila because it's a fleshy region. The patient is allowed to sit carefully with an ease. Then a board or nibandhini or controller of leather or thick stone cloth is tied around either from right to left after massage to resist the movement during respiration, coughing and laughing, etc. Kavaliga, soft part made of soft part. You always know this kavaliga is placed between the bandage. Patient that lie down in cauldron or bathing tub filled with oil. This method is now not practicing. They are wearing a corset, dorsal corset for immobilization. I think that this method is best and we can also adopt. In case of fractured rib, there should be very cautious that these pieces can penetrate to the lung, underlying lung below. Very much attention to be should be kept to avoid the complication. These rib fractures are not important unless many are fractured or unless there are serious injuries inside patient's chest. No complications. Fractures of rib need no treatment except for pain. Lay the patient flat in bed for 10 days. Then the fracture of skull bone. It's a Asatya fracture. Flat bone of the skull fractured without brain matter is coming out. Bath the area with mixture of honey and ghee. Here it is. In case of skull bone fracture, there is a chance of a heavy injury, and the skull is skull has a special blood supply, and chances of bleeding is there. So there is honey, application of honey and ghee is necessary. Instruct the patient to drink medicated ghee only as food. Snehapana, in case of Snehapana, Acha or Vijarna is needed in case of skull fractures. But this is a Kashtasadhya fracture. In my opinion, it is better to refer to experts. The nail bed fracture. crushing of nail bed, and there will be accumulation of blood. Then puncture of this nail bed with RSS or a thick needle is needed, and let the blood flow out. Then the fingertip should be covered with the moist rice flour or shastika shali flour, and then bandage it. Then mandible dislocation, I had described it earlier. Foramen mandible is reduced due to appropriate position. Panjangi menda is applied for support. Nowadays is belt is used. Grida medicated with Madhura and Vadakna should be used for nasya. In this mandible cases only, it is Jatrutha Vigara nasya has been prescribed. In hip joint dislocation, this is a complicated one, and keen attention is to be needed to manage this. In case of this hip joint dislocation, reduction and traction with rotational movement is needed to replace this hip joint. Splint is applied and bandaged. In case of hip joint dislocation, in the case of femur, head of the femur, you should be very careful that if there is any type of head of femur injury or the epiphyseal lesion fracture, there's open reduction is needed. Cracked or bruised femur fracture, reduction of by traction and rotational movements is prescribed here. Here also you should be cautious that if there is you should ascertain that there is no need of prosthesis or open management. After determining the type of management and treatment protocol only, attempt for reduction by traction and rotation movement. In case of iliac fracture, it can be reduced by manipulative procedures like elevation of the depressed fracture and then by bandage and treat with Safer-e-AIAPGET. In case, I am doubtful that how can we apply Safer-e-AIAPGET during the iliac fracture. It needs Kapada Shani. And dislocated elbow joint, it can be reduced easily by using the thumb itself. In supine position, longitudinal traction is needed and hold firmly on the elbow joint, and lateral rotation is needed. Then a click sound should be heard. First massage with thumb, after it should be pressed with a view to set in normal position, alternating with the flexion and extension. The same is sprinkled with oleaginous substance. In case of knee joint, first you locate patella and then flexion, extension and traction is needed for patella. This type of management in wrist joint and ankle joint, this type of reduction techniques is helpful. And dislocation of arms and the shoulder joint, this is Acharya described, can be reduced by a musala. Then dorsiflexion of the one type of management is dorsiflexion of the wrist and then flexion of the upper arm. It can be easily reduced if with a musala or by traction and holding the upper arm and internal rotation and placing the thumb on the shoulder and reducing the joint dislocation if there is any complication. The region of Kaksha raised with an iron rod and bandage the part by Swastika Bandha. In case of depressed nose, elevate with the help of capillary rod or salaga and straighten in case of lateral displacement, and to facilitate breathing or respiration, to hollow tooth should be introduced and the nose is bandaged and with the ghee. In case of teared ear cartilage, these cases are very common because the women are using weightful helmets, and the reduction of this teared ear is taping techniques are now there, and suturing is also nowadays practiced. In our case, apply krida locally, reduce and bandage, and give sadhyavrana chikitsa. Coming to Pathya, the use of levana, kadu rasas, and shara amla articles of food will be denied for any. It will delay the healing. Live on strictest continence and avoid overexposure to sun and avoid physical exercise. Complete immobilization is needed for the fractured place for a particular time prescribed by doctor. For an early healing, wholesome diet is needed. You can adopt shali rice, you can consume shali rice, godhuma, shashtikishali, raktashali, meat soup, okra soup, garlic, milk, ghee, soup of sadhina, a type of sadhina pulse, a type of chana, and all other nutritive and constructive food and chili. Intake of laksha powder with the milk, intake of ashwagandha with the milk, intake of ashali with the milk, and shira kashayas are the supportive diet. Then course of healing fracture. For the youth, it gets healed in the course of a month. In middle-aged man, it will take 2 months. In the case of old-aged man, 3 months. But if a man is 60 years old, the complications or the pain or the discomfort there will be discomforts up to 6 months. This is a general rule. Nowadays, surgeons are of different opinion that different period is mentioned by according to the reduction techniques or open reduction techniques or surgical managements. What are the clinical signs of ideally united bone? How will you determine that the bones are perfectly united? One, by radiological diagnosis. Another, there are some symptoms. There will be no swelling or hardness on palpation. Absence of shortening and deformity is another symptom. And painless and easy movements are the another symptom. Then we are coming to the phase 3. It includes my personal experience share. Why these experiences are shared? To make you aware that many of orthopedic cases and conditions can be successfully handled by Ayurvedic management. I am managing these cases with Ayurvedic management along with the physiotherapy methods and Ayurvedic management with a proper exercise. Surgery can be avoided by doing like this, and a speedy recovery can be attained by adopting these methods and practices. This is a case of Kukundara Marmakshata. As you know, Kukundara Marma is a Vaikalligara Marma and structurally categorized under Sandhima. The location is said to be the either side of the Krishtavamsa, Jagana Behrupaga. It is compared to the location of the sacroiliac joint. Here, this is Kukundara Marma. Kukundara Marma Kshada. This is the first case. This was a 79-year-old male. He was traveling by bus and the bus was suddenly stopped by applying a sudden brake. The standing man fell down and hitting the back of the body, and he was taken to MCS Medical College Kottayam. There was no fracture, no sensory neural injury, but he was not able to walk or stand, not able to move legs. The power of muscles were calculated. This was absolutely normal. There was no wasting or atrophy after 7 days. Pain and contusion at lower back was there. There was no difficulty in passing urine and mild constipation. After 7 days, wearing a brace at his back, he was discharged from Medical College Kottayam. No change in condition. Approached us for further treatment. The treatment given was first Dhanvantaram Thailam Abhyanga, because it is good to Shadakshina, and Talam using Dhanvantaram 101 plus Lasnadi Chudam. Then I applied Marmaki for 7 days. The internal medicines was Dhanvantara Kashayam 15 ml with 60 ml hot water 3 times daily. Mixed with 101 Dhanvantaram 10 drops 2 times daily. Gandharva Hastadi Kashayam with the Saindava and Jaggery for Vadanilomana was given. In Kerala practice, we are always giving Pati Kashayam or Gandharva Hastadi Kashayam soon after the period. He was fully recovered with 7 days treatment. Dhanvantaram Kashayam, the logic behind Dhanvantaram Kashayam is Shadakshinishu Pujidam and the Marmakaya. I am describing about Marmakaya. Marmakaya contains Godhuma, Masha, Sattva, Spotili after gently heating. This can be applied after dipping in gently hot oil made up of bela or kurundoti enna in Malayalam. It can be used for 7 days. If kept it open, no change to make another key after 3 days.